The average annual premium for employer-sponsored health insurance for a family is now more than $23,000 per year and climbing. That's just crazy. It's also unsustainable. Many companies have given up hope that anything can be done in healthcare to lower costs and improve value, leaving them feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to employer organizations around the country, and this is Season 2 of A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Our mission is to help employers lower their healthcare and benefits costs, become more competitive and profitable organizations, and put more value back into their employee benefits.
And now, here's your host and 2022 Broker of the Year, Josh Butler.
Well, hello again. Welcome, everybody. Welcome back to A Snowball's Chance in Healthcare. My name is Josh Butler. I'm the president of Butler Benefits and Consulting. We are a boutique healthcare consulting and brokerage firm located in Amarillo, Texas. I'm also the host of this here program. It's a pleasure to be with you again this morning. It is episode 2 in season 2. I can't believe we're already in January. It is January 23rd. That's today I'm recording. And our beloved Cowboys, God bless their hearts, they got beat last night. It was a rough game to watch. And although this ain't a sports program, I just wanted to console everybody out there that watched the Cowboys game. And hopefully we'll come back next year and have a solid team. But each and every week on this program, we're talking about issues in healthcare to give you a snowball's chance in healthcare. Healthcare is a very confusing, very complex industry, and it's a very expensive industry. And we talk a lot on this program about ways, specific ways to save people money in healthcare. And saving money is great, okay? Everybody wants to lower the unit cost of healthcare, whether you're a self-funded employer or you're buying fully insured health insurance products. It's one of those things that frustrates the living heck out of people, right? They want to lower their cost, and saving employers is a heck of a lot of fun. I get a lot of pleasure, helping organizations lower their healthcare costs. And we're going to talk a lot about that in Season 2. Some of the guests we got coming up later in the season are just some of our partners. We're going to talk a lot about High Plains Health Plan and Apex Community Health Plan. Those are two very highly customized health plans that we've rolled out for our clients in Tennessee and also here in the Texas Panhandle. And like I said, we love saving money, and those plans are reducing employer healthcare costs anywhere from 20 to 40%. But today, we're going to talk about something that's a hell of a lot more important than saving a bunch of money, and we're going to talk about quality care, quality healthcare. There is a correlation between high-quality healthcare and lowering healthcare costs. A lot of people think that in order to save money that you have to water down quality, or you have to, keep people, deny access to care, or decline claims. That's not the way, ladies and gentlemen, that we have found to lower healthcare costs. And we have discovered in our years being in this industry that the road to lowering healthcare costs is actually improving the quality of healthcare that people receive. And that makes a lot of sense. We're going to use some examples here in a little bit. But, I want to bring this back to a very, very fundamental level. And I want to bring it back to the patient level. I talk to hundreds and hundreds, probably thousands of people a year about their benefits and about their healthcare services that they receive. And when I go sit down with people, and let's say it's a person that has a surgery that's forthcoming. They got a surgery coming up. And I ask a very basic question, which is, what do you want? What do you want from this experience? You're about to go under the knife. You're going to be put to sleep. What is it that you actually want out of this experience? And you know what? Everybody has the same version or a similar version of the exact same answer, right? And so if you were to stop and think, I'm about to have surgery, what is it that I want out of this experience? People typically want a combination of a couple of things. Number one, which is always the number one answer, they want to see a good doctor, right? I've never had anyone say, I'm about to have surgery next week, and boy, I hope my surgeon is the worst surgeon that's ever been a surgeon. I hope he's dangerous, and I hope he doesn't know what he's doing. Nobody, I mean, that's just common sense, right? People want good quality doctors. They don't want to go to poor quality facilities, and they don't want to see poor quality doctors. The second thing that's very, very common that I hear people say is, I want my doctor or I want the surgeon to listen to me. I want them to hear my concerns. I want them to answer my questions. That's a very, very common thing, is just a bedside manner, that people want a doctor with a good bedside manner that'll take time to answer their questions patiently and put their mind at ease. I mean, it's a big deal when people have surgery, right? And then, of course, people always have some variation of, I don't want to go broke, so the three things that people want: they want their doctors to listen, they want to see good quality doctors, right? They don't want to see poor doctors, and they don't want to go broke. Now, we didn't even talk about insurance, ladies and gentlemen, in any of that. So when you break it down to a very fundamental level with the patient, they just want to get good quality care, and they don't want to go broke doing it, right? And so when you think about it like that, everybody has some variation of that answer. But let's pause for just a second. Let's go back to an insurance type of model, and I'm going to tell you what the problem with a PPO. We're going to just take a PPO networks plan with a PPO network as an example. Now, for those of you that listen to this program, I know that you probably know by now what PPO stands for, but for those of you who don't listen, PPO is an acronym for Preferred Provider Organization. Preferred Provider Organization, right? But I've got a question about these preferred provider organizations, about these PPOs. What is really preferred, right, about a network where 95% of all doctors and facilities are in the network, right? If 95% of, all the doctors in a community are in network, what's really preferred about that network? And I raised that question, and I raised that point because, we're going to come back to that here in a little bit, but there's really nothing preferred about a network that's that vast and that robust. And so what that leaves you with when 95% of all healthcare providers are in network, what you're going to discover, or what we commonly discover in our analysis, is a network that, of course, has high quality providers in it that charge the lowest prices, right? But what we also find within that same PPO network are very low quality providers. Because let's face it, ladies and gentlemen, just like in every profession, there are great football coaches and there are poor football coaches, right? There are great quarterbacks and there are poor quarterbacks. There are great brokers and there are poor brokers. And just like in any industry, we know that this is true, and it's also true in the healthcare industry. There are great doctors in a lot of places, but ladies and gentlemen, there are some poor doctors in this country as well. Problem is, in a PPO, they're all in network, and your employees who are covered by that network, they have no idea which doctors are high quality and low cost and which one are low quality and high cost. They have no idea, but it's a very, very important thing to know. It even is more important than the price that you're going to pay. Nobody knows the quality. But at Butler Benefits and within, High Plains Community Health Plan and High Plains Health Plan and Apex Community Health Plan, we take it very seriously, and we study quality metrics frequently, often, and very in depth, because we know that is the secret to lowering healthcare costs, is to get people to high quality providers as quickly as you can, and you're going to save money in healthcare. And that's what the whole Mayo model, the strategy that the Mayo model follows. Walmart kind of invented the Mayo model, where when a Walmart employee is diagnosed with a very rare type of disease, they're immediately sent to the Mayo Clinic. And it's not because Walmart is so benevolent, it's because they have also figured this out, is that for rare types of diseases, you're going to save money treating those people the quicker you get them to world-class physicians, right? So this is very, very important. I'm going to break this down, and why it's important, and I'm going to talk about the 5 criteria that we use at Butler Benefits to kind of analyze and assess quality. This is not just, oh, I heard so-and-so is a good surgeon, so he must be good. We're not talking about water cooler talk. Okay, guys? We're talking about quantifiable ways to share information with people on quality, not just on price, but on quality. And so these are some of the tools that we use for High Plains Health Plan and Apex Community Health Plan. And here's the 5 criteria we look at. And think of it like a funnel. And I'm going to start at the top of the funnel, and the way we assess healthcare providers, and it's not a perfect science. I'm not saying that we've got it 1,000% figured out, but I can tell you it's extremely dynamic and it's very, very useful. The first criteria is the service area. This is just based on geography. The first thing we're going to look at is how close in proximity is, and I'm going to use surgeons as an example, okay? Let's say it's an orthopedic surgeon. The first thing I'm going to look at is the service area that surgeon covers, okay? Where is the surgeon located, and how far would people have to travel in order to receive services from this surgeon? So your service area is at the top of our funnel, okay? Secondly, and we can do this geographically all over the United States, not just in the Texas Panhandle. Criteria number 2, volume of services performed. Whatever the surgery we're looking at, if it's a rotator cuff, if it's a gallbladder surgery, if it's a hiatal hernia or a inguinal hernia repair, it doesn't matter. We look at the volume. How many of these surgeries are these surgeons performing in a given year? And that's very, very important, and we're going to come back to that. We know that the more experience a surgeon has, typically we see their quality scores go up exponentially. That is criteria number 3, their actual quality score. So we are mining information and data that pertain to things like their infection rates. How many infections were reported from this surgeon for any whatever procedure we're looking at. Mortality rates, complication rates, hospital admission and readmission rates. So all of these things are quality markers when it comes to services that a surgeon may provide. OR time, that's another one. How long are these surgeons in the OR? The next criteria, which is criteria number 4, is the cost of things like implants. What are they charging? A lot of facilities mark up hardware more than other facilities. So if, like, we're going to use a knee replacement surgery here in just a moment, I'm going to tell you a story. So that artificial knee, some facilities mark that, it's called DME, durable medical equipment. They mark it up a whole lot more than some other facilities. So that, of course, we're going to factor cost in there, because cost is another variable of value. Well, we talk about that all the time. Quality is the other part of value. And so we obviously are going to take it into consideration. The last, which is a very, very small criteria, and it doesn't have a whole lot of weight, but is, for our purposes, is that surgeon directly contracted with our high performance network? Like we have a high performance network within High Plains Health Plan, in Apex Community Health Plan in Tennessee. We use direct contracts extensively, and so that's another criteria. It's not a quality metric, but we also take that into account. And so I'm going to apply this, and I'm going to tell you a real quick story about in Tennessee when we used our criteria for quality metrics. And I'm going to tell you a story. We were assessing orthopedic surgeons that specialized in a particular procedure. It's a DRG 470. Y'all hear me talk a lot about DRGs. Well, a DRG 470, ladies and gentlemen, for those of you that don't speak the industry lingo, is a bundled package for a total knee replacement. So it's a pretty common surgery. It's becoming more and more common with an aging population, and unfortunately an overweight population. Knee replacements are pretty prevalent in this country. But we assessed, what we were trying to get down to is, who's the best surgeon to refer and to steer our members to if they need a DRG 470. Okay? And so I'm going to walk you through that and how we used, and I'm going to share the real numbers, guys, on the amount of surgeons that we analyzed, okay? And so what we did is you start with that market area, that service area. How many surgeons are within a 100-mile radius? That's where we set the criteria on criteria number 1, which was, the area. That's the top of the funnel. We identified 60 orthopedic surgeons within a 100-mile radius of where we were doing this analysis that were orthopedic surgeons who had at least performed one DRG 470. So there were 60 that we started out with, okay? And then as we go down the criteria list, we start to prune the numbers and we start to eliminate surgeons that we would not want to, aggressively steer our members to. So when we applied that, 60 orthopedic surgeons were within a 100-mile radius who could perform a total knee replacement. Criteria 2 is all about adequate volume. Now, we set the threshold, folks, strategically at 50 knees per year, okay? So if a surgeon hadn't done 50 knees in a year, we kicked them off the list, okay? So at the top of the funnel, we were able to immediately remove 46 surgeons out of the 60 and narrowed it down to 14. Only 14 out of those 60 had performed more than 50 total knee replacements in a year. And guys, I want to pause right here for a second because it's important to explain this volume, this adequate volume criteria real quick. And did you guys know that if the 50 is a magic number when it comes to this particular knee replacement? There's studies out there that support this, that show that the complication rate for a DRG 470 from a surgeon who's performed fewer than 50 knee replacements in a year is 4%. So it's not real high. 4% of cases are going to end up in some pretty major complications. But when we get to over 50, okay, when we put the number at 50, we see the complication rate drop from 4% to under 2.5%, ladies and gentlemen, when the surgeon has performed more than 50 total knees in a year. So obviously, I mean, this is common sense. The more your surgeon, I'll just ask you, if you're going to have a total knee replacement, do you want to go to a guy that's done 50 knees in a year or a guy that's done 10? I ask people that question all the time, and they're like, well, definitely I want to go to the guy that does 50. He's got more experience, right? And so it's important to know that volume is an important criteria. So when we apply volume, we're looking, we just automatically were able to eliminate 46. We went from 60 down to 14, okay? Criteria 3 was the total overall quality, the things that I told you a second ago we were assessing. Infection rates, mortality rates, admission rates, readmission rates, complication rates, all of those things were taken into consideration, and we set a benchmark for that. So out of the remaining 14, we were able to eliminate 6 more. That put us down to 8 orthopedic surgeons in a 100-mile radius. Okay, now I'm going to come back to this quality criteria here in just a minute because I'm going to tell you something very, very interesting what we found in the data. Okay, so now we've whittled our list down to 8 orthopedic surgeons. The next criteria was the overall cost of the implant, the overall cost of the surgery. What we found out of the remaining 8 is that there were 2 that were just exorbitant. Their pricing and their costs were just out of control, so we kicked them out, okay, and just said that's not worth the value. The value's not there. They charge way too much for the procedure. So that narrowed us down, ladies and gentlemen. We started out at a 60, and we ended up at 6. And then finally, on the 5th criteria, which is, do they have a contract with one of our health plans? 2 of those surgeons out of the remaining 6 had contracts with Apex Community Health Plan. Now, this is very, very important, ladies and gentlemen, because all 60 of the surgeons that we initially identified were virtually in every single PPO network in America. Okay? They were in network with Blue. They were in network with Cigna and Aetna and Humana and United, and they were in network with all the carriers. But were they all great? No, they weren't. So I'm going to go back and I'm going to tell you what we discovered at step after we narrowed it down from 60 to 14. We identified a particular surgeon who he was in the 100-mile service area, And he had done more than 50 knees a year. As a matter of fact, he had done 106, ladies and gentlemen. He had performed 106 total knee replacements in a full year. But what we found, out of those 106 knee surgeries that he performed, he had 3 mortalities in 1 year. 3 people died in his OR from a DRG while getting a DRG 470. Now, no other surgeon in the 60 had a mortality, and this surgeon had 3 mortalities in 1 year. Now, think about that for 1 minute. Just stop. If it's you, or if it's your wife, or if it's your kid, or whoever, if it's your grandmother that's having a total knee done, do you want to send your grandmother to that surgeon? Raise your hand if you want to go see that surgeon. I know I don't. I don't want to go see that surgeon, right? But inside a PPO network, this surgeon was in all of these major PPO networks. Your people that are covered by your health plans under these networks have no idea when it comes to quality. And that's why, ladies and gentlemen, it's so important to work with people and to work with consultants and work with people that know how to get this information. I mean, I don't want to send any of my clients to a surgeon like that, right? I want to be able to recommend and say, well, you can go to any of these 60, but if you're looking for the best, I can show you who the best is per these numbers. And I know that these numbers can be, skewed a little bit depending on the facility and the location. And surgeons yell all the time, this ain't fair, this ain't perfect. I told you from the beginning, it's not perfect science, but it is data. It is quantifiable data that plans and employers should be using, because this is the secret to lowering healthcare costs, is getting people to those 6 surgeons. You want to save money in healthcare? Improve quality of care that your people receive. My point is, within a PPO network, you have this huge mix of high quality and low quality, high cost and low cost, and your employees aren't incentivized to choose high quality care. That's what makes High Plains Health Plan different. That's what makes Apex Community Health Plan different. We build in financial incentives within health plans, and we financially reward covered members to go seek care from a high quality, low cost provider. And we use 5 criteria that I just outlined to show you exactly how our plans do that. And it's a lot of work, and it's going to continue to be a lot of work, because new people are entering into the healthcare world and older people are exiting out of it. It's always kind of turning over, but that's our job as consultants to keep up with this kind of work. But ladies and gentlemen, bottom line, right, is nobody, when we ask people, what do you want? Nobody wants to go see a poor quality doctor. Nobody wants to go see, in the healthcare industry, there's an acronym for that guy that had 3 mortalities. It's called a HODAD, Hands of Death and Destruction, right? And that is a clinical, or it's not a clinical term, but it is a term in the clinical world to identify these surgeons that are dangerous. You all have, if you've never heard the podcast Dr. Death, go listen to season 1 of Dr. Death, and Christopher Dunch was an orthopedic surgeon and spine surgeon in the DFW Metroplex, and I believe he's still in prison to this day. I mean, his track record on quality, those things can be better managed, okay, with the right data analytics tools and things of that nature. So that's going to do it for episode 2 in season 2 of A Snowball's Chance in Healthcare. I'm really looking forward to this season, because we're going to get into some really intriguing topics this year, folks, or this season. Going to have some great guests. We're going to talk about traumatic brain injuries. We're going to talk about orthopedic surgery. Of course, one of my favorite topics is prescription drugs. We're going to have some folks on here to talk about that. But we're also going to have some local healthcare people that serve the Texas Panhandle very, very well, from some of our strategic partners that are going to come in, and we're going to talk all things local healthcare related, and I'm really looking forward to it. But Tune in next week. We'll be here to cover another topic where, as always, we're talking about things in healthcare to lower your costs, improve your quality and access, and to give you and your organization a snowball's chance in healthcare. God bless. Have a great weekend.